All right, I'm so glad to be joined by my good friend Chuck Pennacchio from OnePayerStates.org. Chuck, thanks for being my guest on Halitics.
Absolutely, Hal. Pleasure. I'm really happy to be with you.
You know, Chuck is a very well known personality, political personality, especially in the state of Pennsylvania, where you ran against then U.S. Senator Rick Santorum. You challenged him on the Democratic slate, and then in the primaries. And how what was that like for you to be a political, candidate running for office?
Well, it was a race that I was determined to change the trajectory because the Democrats had not won a full U.S. Senate seat in Pennsylvania going all the way back to 1962. And just the thought of Rick Santorum getting reelected was just horrifying to me. And I talked to a few friends. They said, Chuck, we'll back you. We'll support you. Just get into the race. And by doing so, I was able to get Bob Casey, who ultimately went on and won the Democratic nomination and the seat to get into the race sooner, I think, than he probably would have. So I think I played a beneficial role in terms of flipping the seat. But it also, longer term, was a victory because out of that campaign came the statewide Healthcare for All Pennsylvania campaign, the single payer campaign statewide. But what was it like running? It was a challenge because I was an outsider. I mean, I was running as a Bernie-crat before Bernie came. I was running a little bit on the model of Paul Wellstone, for folks who are familiar with him from Minnesota. And we did 328 public events in 2.5 years. It was events, it was house parties, it was debates. It was entertaining in many ways. I think it was exciting, and allowed me to connect with people at the grassroots level and establish relationships. And I think that's where our politics really needs to start, is building relationships. And out of that, we built something very special in Pennsylvania, and then beyond with One Pair
No
States.
question about it. I met Chuck through organizing in Pennsylvania, and he's just always been a great leader there. Now he has moved on to DC area, and he's working, as you can see, OnePayerStates.org. We've got the caption there, the screen capture from the website OnePayerStates.org. I do urge folks to check out that website right now. And just before we get right into the conversation about healthcare and One Payer States, Chuck, what was the year? It just occurred to me, was that 2002, 2004 that you challenged Santorum?
Six, actually, 2006.
2006. So of course
Yeah.
it was neither of the above. was the answer. So 2006, when Chuck Pennacchio was in the forefront of the Pennsylvania movement away from the conservatives, and of course Santorum, a real social conservative as well, and you running as a true progressive. Chuck, tell us about One Payer States.
Right. So the frame One Payer States speaks to the fact that it is single payer. One payer is another way of saying single payer, but because so many people are predisposed and biased one way or the other to single payer, we wanted to use a phrase that would invite the conversation. And so I've found that it's been very effective. As I pivoted from the Senate race and became executive director of this newly formed Healthcare for All Pennsylvania, it became that much more effective, efficacious to engage with Republicans, with centrist Democrats, with independents, and just have the conversation around healthcare and how we can make healthcare accessible to everyone, restore choice to patients, and restore the relationship between the patient and the provider. That's where the decision should be made, not by some bureaucrat with a health insurance company, or some such problem that really meddles with our healthcare decision making. And also, it's a system that will generate new jobs. It'll generate new economy. It'll bring rural hospitals back. It'll bring urban hospitals back. It's win-win-win, except for the CEOs of the big four, what I call the medical industrial complex entities, the industries. That's big hospitals, big pharma, big insurance, and the big medical device industry. Those four make up what I call the four horsemen from hell, who are making healthcare in the United States just that much more difficult and expensive and inaccessible. So we have an answer for reversing all of those developments, over the last several centuries or the last several decades.
All right, again, Chuck Pennacchio with us on Halitics. By the way, please click subscribe, bottom right of your screen. If you haven't yet done so, there's a blue and white square that you can click and become a Halitics subscriber. Would truly appreciate that. Chuck, I mean, I have so many questions. We did kind of script out a little bit what we were going to discuss, but it just occurred to me, I'm a little confused. Why do we need some newfangled healthcare system when we've got the Obamacare brought to us by a progressive Democrat? What's wrong with that? Why don't we just expand that, which is what some of the Democrats are talking about?
Well, first of all, the idea originated with the Heritage Foundation back in the 1990s. The idea of Obamacare first gained success as Romney Care. Mitt Romney, moderate conservative Republican in Massachusetts, and the system in Massachusetts is inadequate. The Affordable Care Act, as it's come to be known, it was the Patient Protection and Affordable Care Act, quite a mouthful. Speaks to the fact that Democrats are not good at messaging, but nonetheless, that was not a good program in the sense that it did not tackle the cost drivers in healthcare. It was good in that it brought about 30 million people into the system who previously did not have healthcare. But for those who already had health insurance, their prices went through the roof. And in fact, we know this, that it was a huge benefit to those four industries that I mentioned, that their stock prices went through the roof. They went above 300, their stock portfolios tripled in value. After the passage of Obamacare, also known as the Affordable Care Act. So it was not actually progressive legislation. A lot of progressives bit their tongue and voted for it, or held their breath, I should say. And it's left us far short of where we need to be.
Yeah, I actually remember at the time of the debate, I was a pundit at that time, and I was fortunate enough to get asked to be on a show. I was asked whether I thought it would be a solution, and I just said, I really don't know. There are some things I really like about it, but it's way too early to tell if this kind of kludge, as Paul Krugman called it, would really address the problems, which were ever higher prices. We had by far the most expensive healthcare in the world per capita, as well as many, many uncovered people, Chuck. And then you can add on to the costs, uncovered people, even those who are covered have to pay out of pocket, often many thousands of dollars, which they may not be able to afford.
Right. Well, and I'm a casualty of the so-called healthcare system that we have. I was organizing my colleagues at University of the Arts, a labor campaign, and I was fired. I mean, I've been without health insurance floor beneath me since I turned just before my 62nd birthday, and I'm still a year away from Medicare. So I'm somebody who is very fragile, and I don't mind just telling folks I'm blind in the left eye. My right eye is compromised. I've got health issues related to a recent auto accident. If I was in Denmark, if I was in any other country in the advanced industrial world, my healthcare issues would be taken care of. But as it is, I'm having to pay out of pocket. I'm having to scramble to get doctors to even see me because I don't have health insurance. So I'm paying cash out of pocket, and I'm not somebody with deep pockets. I'm living on early Social Security, and starting to melt down my pension. So, I'm a good case of somebody who is a real casualty of the system.
I'm really sorry to hear all that, Chuck. I know we've discussed this in brief, but I didn't realize the situation was quite so serious. And of course, many other Americans are similarly situated. If we are a compassionate nation, we must recognize healthcare, I believe, as a universal human right.
Absolutely, Hal. And I think maybe setting the larger context and reminding people that it was 75 years ago. I think we may have talked about this the other day, that Eleanor Roosevelt led the charge for the Universal Declaration of Human Rights, which outlined all of the critical needs, human needs that everyone in an advanced society should absolutely have available to them. And it's not just healthcare, but it's housing, it's quality education, it's a clean environment, And now, as we're going deeper and deeper into the climate emergency, we need to have a society that can pull together and really tackle these crisis issues. As it is, we have a bogus impeachment inquiry going on while the government nearly shut down, and while the Republicans have yet to settle on a speaker, while we now have a crisis in the Middle East with the Palestinians and the Israelis once again, a situation that itself was never resolved 75 years ago. And here we are in 2023, 75 years after the founding of Israel and the founding of the UN Declaration of Human Rights. And the problems that were attempted to be addressed at that time have been largely not only ignored, but actually we've receded. We've actually gone backwards, especially over the last 50 years since the Johnson Great Society programs in the 1960s.
So one of the things I really, and 100% on everything you said, Chuck, one of the things I sometimes tell my viewers that I really appreciate about doing this program is I learn an awful lot. And one thing I learned about from you when we were discussing one-payer states is Sabuca. And when you said that, I was like, wait, are you talking about that liquor that kind of tastes like licorice? Is that what you're talking about? Sambuca? Is that what that is? And you had to set me straight. So I put the screenshot up. This is from the onepayerstates.org website. Your ally, Ro Khanna. What is Sabuca?
It's an acronym. It stands for State-Based Universal Health Care Act. So 6 words: State-Based Universal Health Care Act. And it references the legislation that Ro Khanna is just now beginning to circulate among his colleagues to get people to sign on, his members to sign on, his colleagues to sign on as original co-sponsors. That's why the timing of our interview here today is just perfect for getting the word out and encouraging folks to get their members of Congress to sign on with this very powerful legislation that's designed to help elevate, to lift states, individual states, as well as states that are collaborating amongst themselves to create universal healthcare systems by being able to capture the federal healthcare dollars that are currently being paid into Washington, bring those back to the states with guardrails, making sure that those dollars are designated for healthcare and no other purpose, and then also to get a legal waiver so that the states are not dragged into the courts by big businesses that see a competitive advantage with the existing system. So SABUCA, State-Based Universal Healthcare Act, it's a very powerful piece of legislation that was previously carried by Pramila Jayapal, and prior to her, Jim McDermott. So we're really excited about the rollout of this legislation right now, a very critical time.
And I'm sorry, go ahead. I didn't mean to interrupt.
I was just going to say that because the Republicans are in charge of this Congress, we really need to flip this Congress. And our goal is to get this legislation to pass in the next session, 2025-26. But we have a huge amount of work to do in terms of education and in terms of just mobilizing our forces and building coalitions in support of this. Because to me, this is the lowest hanging fruit. This is the greatest path to opportunity to get modeled states, to get states to model universal healthcare systems. And as we talked about the other day, that's precisely how Canada got to national healthcare, got to Medicare for all. Canada did so through the province of Saskatchewan. So that's what we're looking to do, is to model 1, 2, or 3 states to show how incredibly successful this legislation will be in terms of modeling universal healthcare for the nation.
So I think you see there's a couple of links there. They're pretty long. So the best way you can click on those links is just go to onepayerstates.org. We've got the website up. It's very easy to remember, onepayerstates.org. And the website is it's simple, it's easy to negotiate. And this is how you can let your Congress member, I did this with Jamie Raskin, who's my representative, to let your representative know in the House you support Sabuca. Do you have a Senate sponsor at this point? I know that Khanna obviously is a sponsor in the House, Chuck.
Yeah. Not yet. We've been working at this for a couple months, and we think we're closing in on someone, but I hesitate to put any names out. That would not be appropriate. But the goal here is to get a senator to carry what we call a companion bill, the same legislation on the Senate side. And since the Democrats are the majority, we would anticipate getting hearings and potentially votes this current legislative session.
So, a couple more questions about that. First of all, just personally, what is your role in this movement?
So the one pair of states dates back to 2009-10, right about the time of the birth of the Affordable Care Act. And we were making great progress in a number of states. And when I say we, I'm talking about states that weren't yet communicating with one another. And then I got put heads together with folks in Maryland, where you're based, in California, and we were in the process of pursuing an economic impact study to prove the economics of single payer, how much cheaper it is, how much better it is, how much it'll generate jobs and provide quality, comprehensive healthcare to all. So in that process, we put together a proposal, and we were in the process of taking it to the Lewin Group, which was a study group, a think tank, the leading think tank on healthcare economics. And just as we were putting forward that proposal, United Healthcare of New York bought up the Lewin Group and then put it out to pasture. Just melted, just destroyed it, put it out, just destroyed the think tank. But however, we have had economic studies done through other avenues demonstrating every single time that single payer proves to be by far the best pathway to getting what it is that we actually need. Guaranteed, comprehensive quality healthcare for all, far more affordable, and restoring choice to the patient and decision making to the patient and provider relationship.
It's really such a no-brainer. We know in the real world, I mean, there's tons of real-world examples, right? I mean, every other country, even countries that are much poorer than we are, seems to have been able to figure this out, spending much less per person on healthcare and getting, in many, many cases, significantly superior healthcare outcomes. Even in the United States, weren't you telling me that the VA, for all the problems that the Veterans Administration has, people who have Veterans Administration coverage, which is single payer for sure. It's kind of like the National Health Service in the UK, where the medical providers work for the US government. They're the most satisfied of any Americans with their care.
Absolutely, absolutely. And just to tease out the earlier part of your question, what it is that I'm doing. When we formed One Pair of States back in 2009-10, at that point I was executive director of Pennsylvania. And then in 2015, after 10 years of doing that work, because 2006 is when I started, I took a leave to do the Fix It film, and would encourage people to take a look at that, fixithealthcare.org. It makes the economic argument. I stepped away and decided that it was time to really begin bringing One Pair of States together as a more cohesive organization. And so we've spent really the last 5 years plus reforming ourselves as a 501c4. And I've been serving as president during that time. And now my role really is lead lobbyist on the SABUCA legislation, the state-based universal healthcare legislation that Ro Khanna is carrying. So that's my role here, is to meet with as many members on Capitol Hill, both in the House and the Senate, and their staffers, so that we can develop, again, I think all of our politics needs to begin with relationship building, trust, conversation, communication, rather than having people talk past each other and staying only on social media. We've got to get off of that and talk to each other and build these relationships. That's, I think, the pathway forward. And beyond that, we need to connect all of our justice movements, I believe. We're not going to win on healthcare justice alone. It's got to be health and healthcare justice. Health addresses all those other issues we touched on: housing, climate, policing, education, all those other issues. We've got to collect ourselves, bring ourselves together, and understand that the higher goals that we aspire to achieve are achievable. And we've got history on our side. There are more than 1,000 examples in American history of reform movements that have been successful when people pull together.
All right, let's get through just a couple more questions. I don't want to keep you too long or keep our viewers either, but I think there's some really important nuances that we want to get into. So how does this jibe with the push by many advocates for the so-called Medicare for all? Bernie has introduced this. Rep. Jayapal has introduced this in the House. Are these parallel paths to the same end?
Yeah, absolutely. I'm an historian and a political activist for 50 years, and I've married academics and activism together, for several decades. And my study of our history and understanding of our Constitution, when it's working, is that the best pathway to achieving our goals actually is to model solutions at the state level. And you can see so many solutions, the right to vote, suffrage, women's suffrage, expanding suffrage, bringing younger people into the system, child labor laws. The entire progressive agenda was established in Milwaukee, and then expanded to Wisconsin, and then went national with Teddy Roosevelt. Precisely, local, state, national. Same thing with the New Deal. Most people are not aware, but it's true that Franklin Roosevelt modeled most of the New Deal programs when he was governor in Albany, New York. Same thing. And so many of the reforms that LBJ put forward in terms of Great Society were being modeled at the state level in the 1950s and 1960s on civil rights. And so this is our history. We cannot turn our back on that history. So to answer your question, absolutely, it's complementary. What it is that we're doing is seeking the what we see as the theory of change in our society. We believe the best opportunities at this time, given the role of money, Citizens United, the way our politics have been bought in Washington, D.C., the best pattern or the best prospects really are at the state level right now. Does that mean that we give up on the fight in Washington? No. I mean, that's in part why I'm here, to support the national campaign for single payer Medicare for all. But ultimately, Pramila Jayapal will tell you that it's going to be the states that will model it. And Bernie has said as much, that it's more likely the pathway to getting to national solutions is through the state level, in particular on healthcare.
As I understand it, there are two states that are getting close to the kind of legislation we're hoping for in the Pacific Northwest, Oregon, and Jayapal State, Washington State with whole Washington. Can you kind of just give us a brief update of where they are and whether it's essential, in your opinion, that we also pass the SABUCA to protect against legal challenges to those programs, if they're passed, if they become law?
Yeah. I mean, you've waded into one of the more, I guess you would say, controversial questions surrounding SABUCA, the State-Based Universal Healthcare Act, and that's ERISA. And we don't want to get too deep into the weeds here, but ERISA, Employee Retirement Income Security Act, was an act of Congress back in 1974 that precludes state governments from meddling with or in any way infringing on private benefits programs. And so the idea behind ERISA, ERISA, was to protect private companies. And at that time, healthcare costs were maybe 5-6% of GDP. Now it's 18-19%. So it's a much bigger deal now. And these big companies like the Boeings and the Starbucks of the world, these companies want to keep the system that exists right now, though it damages the whole of society, because it gives them a competitive advantage against smaller coffee houses, against smaller manufacturing companies, because they can self-insure. In other words, they can figure out ways to provide insurance to their employees, although we have to say that it's all wholly inadequate anyway, what they're doing. But nonetheless, they're opposed to universal health care. So what we see in Oregon and Washington is a state in Oregon that just recently passed a constitutional amendment declaring healthcare as a human right in Oregon, so that the legislators are duty bound, constitutionally bound, to create a universal healthcare system that works for all Oregonians. And in Washington state, they passed legislation that established a permanent universal healthcare commission. And they're directed to creating a universal healthcare system. And as we've talked about here, the only proven way in the American system is single payer, which is publicly funded and privately provided guaranteed healthcare for all. It's a hybrid solution. It's an idea of the left, public funding, an idea of the right, which is choice of provider. And that matches and marries really how Americans think about the way that they go about their daily lives. They want to have choice, but they also want to guarantee that they're not going to lose their house, As you know, personal bankruptcies, 60% of them are related to medical debt in this country. 60% of personal bankruptcies are related to medical debt.
Yeah, again, this is just an idea that whose time came years, decades ago, a
Absolutely.
millennium, in the last millennium. And
Yeah.
hopefully, because of your hard work and other similar activists, we'll get to where we need to go. I thank you so much for doing this, Chuck. Just a couple more quick questions. When you told me you were doing this, I was not surprised that you were. I mean, I knew you'd be focusing on justice, but I wasn't like, I didn't like, oh yeah, of course Chuck is working on healthcare, because as you mentioned, your focus has been very broad, and I know you're one of the I guess justices that is dear to your heart is racial and sex justice. Would a universal health care plan move us in a direction towards racial justice and justice for women and people who are not non-binary or
Absolutely.
non-cisgender either, for that matter?
Right, right, right. And to Ro Khanna's credit, Representative Khanna, he's put explicit language addressing reproductive health care, comprehensive reproductive health care, and gender affirming care, so that it's intended to bring everybody under our vast, diverse society under the same tent and give everybody the health care that they need when they need it in a way that everybody can afford. And it's really a vision that is going to get us where we need to be, is really seeing our society coming together. And healthcare is one of those core issues that intersects with so many other justice issues. And I believe that we're on the path to victory.
Well,
Absolutely.
and let me just throw in, and you did allude to this earlier, rural justice as well. So many rural
Absolutely.
Americans, regardless of their ethnicity or race, just cannot access healthcare. I understand in Texas, people are driving several hours to get to a hospital, and of course, that they may get there too late.
Right. I believe it's in 60% of rural America that the primary health care source is Walmart and Dollar General. These are vast healthcare deserts where people are, because rural hospitals are just vanishing. And so, in these areas of the country, huge swaths of land where people have no hospitals, very little clinical support, doctors are at in shortfall. People get they get whatever healthcare they're able to get from a private for-profit company like Walmart, and Dollar General. And so if that's people's orientation to healthcare, that's really damaging to how we're going to think of ourselves as Americans, uniting and pulling ourselves forward and moving together. So this idea of modeling a universal healthcare system at the state level, I think it's revolutionary, and like as you said, its time has long been coming.
All right, Chuck Pennacchio with us from onepayerstates.org. Chuck, I'm going to put you on the spot, and then I'm going to ask you for your final words. Do you trust the Democrats to get this done?
I trust ourselves to get it done. I mean, I trust the people we work with to get it done. Yeah, we've got some Democratic leaders, Ro Khanna, Pramila Jayapal, Bernie Sanders, and we're grateful for them and for their leadership. So we need an inside-outside game, right? So we need to understand, and that's why I'm here in DC, is that we've got to work hard on the inside to cultivate those relationships, to break down the barriers of indifference and cynicism among a lot of electeds, and get them to see and understand that it's in everybody's self-interest to roll up our sleeves and to go forward with a proven solution that will lift everybody's boat. Everybody will prosper. So it's got to be an inside-outside strategy, but primarily outside. We have to create a vast movement on the outside to bring pressure to bear and holding politicians' feet to the fire. We intend to bring on any number of Republicans, as that party ultimately has to reform itself. And there are swing Republicans who are going to try to find a way to curry favor with their own populations, their swing state populations, swing district populations. And so I believe we're going to get a handful of them on board. And then there are also the center right, some people call them corporate Democrats, who are beholden to a lot of the healthcare industry funding. And we need to break that chain. We need to call out those members and simply tell them, stop taking those monies, do what's right for your citizens, for your constituents, and we all will prosper.
And if you want to join that fight with Chuck, click on onepayerstates.org. I'll have the link in the description below of this video. I promise you the final word. Charles, go ahead.
Well, Hal, grateful to you and to your the folks who follow you. I've always had a pleasure working with you over at our revolution. I think we did some great work collaborating in Pennsylvania. And the results in Pennsylvania is that the progressive caucus within the state Democratic Party is now running that caucus. I mean, that's something that, it's progressives. It's mostly our revolution people who have taken the reins and have elevated the discussion around core issues that we all are desperate to get resolved. So, I'm grateful for the work we've done together and will continue doing together. And it's a testament to the grassroots emphasis of your constituencies, your own audience here, and believing in ourselves. And I guess the last thing I would say is that it's my organizing mantra: radical hope, radical hospitality, and radical hope and radical love, and built around a core strategy. But what that means is we need to welcome one another. We need to listen to one another, really being very intentional in welcoming. And then we need to think in terms of what it is that we can accomplish, rather than being told by cynics and pundits, talking heads on television, that we can only expect to do so much. We're in a crisis period, but out of crisis comes opportunity, and seeing that opportunity, I think, is what all of us need to envision. So it's visioning our success, and then also understanding that involves communication. It involves bringing together resources. It involves looking logically at the political system. Where are the easiest, or the best pathways to achieve what it is that we need to do? We need to be opportunistic. And we need to study our history and see how others have been able to succeed in the civil rights and the feminists and the environmental movements. What is it they did that we can learn from and apply in the present? So I think it's about learning who we are and believing in ourselves once again, and then joining forces, and then creating this really a tidal wave of political power that's going to prevail ultimately.
That's awesome. I'm so, I feel more optimistic already just hearing from you, Charles. Chuck Pennacchio with us, onepayerstates.org. I'll be back. I'll be back, and we'll have Chuck back with us as well. Have a great rest of your day.